Yesterday, we heard an excellent talk by Dr. Carlos Hernandez introducing the Nicaraguan approach to the COVID-19 pandemic. In my presentation, I will bring some key facts of that disastrous management that Dr. Hernandez was mentioning and its tragic consequences. I will also take a few minutes to talk about a recent study on the effects of the pandemic, specifically on healthcare workers from different hospitals in Nicaragua. The Nicaraguan government has adopted basically no health measures to address the pandemic. It also ignored WHO recommendations for massive testing, quarantine, and social distancing. Business, schools, universities, they all remain open all the time. And in justifying their approach, what the government was trying to respond to months of criticism from the experts was that they claimed to be following the Swedish model. And in this model, what they meant was that they were doing some epidemiological control at the borders, which we have to say it's a very relaxed vigilance, which relied mostly on travelers declaring any symptoms. Since very early in the pandemic, they declared that there will be no quarantine in Nicaragua. Instead, all through the pandemic, the government has been sponsoring rallies, fairs, and sporting venues. In summarizing the problem, as a potential explanation to this negligent, reckless management, we should point out the political interference with medical and scientific decision-making, which was very detrimental to the health of the population. They have imposed censorship and intimidation on public servants working at health institutions. The other reasons are the lack of pandemic preparedness, weak surveillance systems, short capacity for PCR testing, and scarcity of PPE and other critical care equipment. Slow decision-making processes, and importantly, disregarding scientific advice. In addition, they pay no attention to aging population and vulnerable groups, and to indigenous and Afro-Caribbean peoples, which largely experience health and social inequities. These problems was also exacerbated by the fact that we had the effects of a 2-year-long social, political, and humanitarian crisis that has depleted the health workforce and reduced public health systems capacities. Even now, 8 months through the pandemic, the government is still allowing large gathering and most sports to continue despite the COVID threats. Moreover, the government did not provide stimulus to mitigate the pandemic's economic decline. Here in the picture, we see a street vendor by a hospital corner using a mask, and these workers are in large numbers in Nicaragua, and they had no choice but to leave home to earn their daily wages. A few words about testing. We have no trust in the current official COVID data. Serious issues about accuracy of reporting emerged since the very beginning of the epidemic. The reported numbers of infections is looking increasingly like a faulty metric for estimating the outbreak. In downplaying the threats posed by the virus, the government has not shown any interest in carrying sufficient diagnostic tests for COVID. And at some point, they instructed hospitals on a daily quote. You can see the remarks here on the right, a daily quote of 50 tests per day for the whole country. The number of tests and results are safeguarded through the CNDR. This is the central laboratory with an iron control over data. and the data handling with secrecy that characterizes the government, providing limited, improbable, and confusing data on the number of infections. For example, in the beginning of May, they introduced an unbelievable mortality rate of 27%, among the highest in the world. And then in May, mid-May, in just 1 week, the numbers had an increase of 1,000%, definitely a world record. And we conclude that there is a lack, the lack of diagnostic testing is the major bottleneck of the whole approach. The real magnitude of the tragedy is practically impossible to tell, but here are some of the deadly consequences. In the absence of effective containment, it is overwhelming the precarious health system. The light approach taken by the government revealed serious deficiencies in the Ministry of Health. PAHO itself has expressed concerns for the situation in Nicaragua, demanding information on the number, the type of tests, and their results. This lax approach to the world pandemic caused the numbers to rise and resulted in serious problems for the medical community. The Citizens Observatory, an independent NGO, reports around 10,000 cases and 2,700 deaths. This is an important point to make. We prepared this graphic just to show how it compares the numbers of deaths per million in Nicaragua. According to the Citizens Observatory, Nicaragua has more than 406 deaths per million. And in Latin America, as you can see, the numbers are very high. On the top, Peru, Chile, and Brazil, and Nicaragua is among those very close to Panama and Mexico. So physicians have called for prevention through different statements. They have called for mitigation measures, and they have denounced the lack of PPE in the workforce, the health workforce. During the worst months of the pandemic, in mid-May and June, the majority of the health workers were completely unprotected. Many doctors and nurses were getting sick without appropriate safety equipment, weakening the health system. And data from Citizens Observatory estimated that around 700 health workers were infected. And of those, around 100 died. Possibly around those, more than 40 medical doctors. And PAHO, the Pan American Health Organization, importantly said that it is vital that the country implement public health measures to stop community transmission and save lives. So to address some of these problems, I'm very moved by the difficulties of the health workers in Nicaragua. In collaboration with colleagues from the University of California and with assistance from New England Biolabs in Massachusetts, we participated in a study to determine the prevalence of COVID-19 in health workers. This figure shows the cumulative numbers of COVID-19 cases in Nicaragua. Here we point to the shaded area showing the period of the study, which was performed between June 22nd and July 24th. The first case of COVID in Nicaragua was reported in March 18th, and this is where the graphic starts. And the arrow indicates the beginning of the exponential growth in the beginning of May. And please note the difference between the data provided by the Independent Citizens Observatory, the top curve, and the official data registered weekly by the Ministry of Health and reported by the Johns Hopkins University Center. Now, in this study, the key virus detection technique used was the LAMP method. LAMP stands for loop-mediated isothermal amplification, which has been an established nucleic acid amplification technique offering rapid, accurate, and cost-effective diagnosis for infectious diseases such as Zika, HPV, and others, and more recently has been widely studied and used for SARS-CoV-2 detection. And I bring here some authors such as Dao and colleagues who have shown sensitivity of 97.5% and a specificity of 99.7%, basically pretty much the same comparable to the standard RT-PCR. And this methodology is very important for the point of care, but also for developing countries, and is suitable for an early case discovery. And we thought that this would be very clever for isolation in most Nicaraguan hospitals. And the method basically relies on colorimetric techniques for fast quantitative and qualitative detection of SARS-CoV virus directly from saliva without the need for expensive fluorescent equipment, or even without the need for an RT-PCR machine, which are usually expensive. And this reduces the risk for nosocomial viral transmission. So to the data, I'll just show a few of these data of this study. And there were 402 participant volunteer health workers. And the major finding is that around 30% of the health workers turn out to be positive for SARS-CoV-2, 30.35% to be exact. And we didn't find much difference between male and females. Males around 32% and female 29%. Regarding the prevalence, according to the rural hospitals, also, no significant differences, and we can see here a little less for nurses and around 32 both for physicians and others. In others, we included different radiologists, other technicians, assistants to medical doctors, and even some cleaning people. Regarding the ages, we found that among the positives, the majority, the largest group testing positive was around 28% for the ages between 20 and 29. The second group being the 40 to 49, and the third group, the 30 to 39. Regarding the prevalence, we wanted to compare how they compare in public hospitals and the private hospitals. And we found around 38% in public hospitals and around 29% for the private hospitals. Also, we asked through a questionnaire whether the participants had a family member at the moment, some family member with symptoms of COVID-19. And we found what for the majority, for the participants, we found around 23% declare that they had family at home with COVID symptoms. And at the same time, for the positive group, just those that turn out to be positive, 32% claimed that they had family members at home with COVID symptoms. And an interesting data is the associated symptoms. In Nicaragua, most of the associated symptoms, the highest are headaches, pains, cough, dry cough, and sore throat and fever. Interestingly, we also found around 21% also for anosmia and ageusia. And we also found some other symptoms associated with COVID. But most importantly, an interesting data that we found is that 55% of those positives are really asymptomatic. They don't declare any symptoms at all. And most interestingly too, that if we take the younger than 50 group, 58% of those people are asymptomatic. We found in the literature that this is also the case in some countries, but this is also, I think, remarkable for discussion. We should probably talk about this in discussion because we are finding all through the world that the new wave of the virus is actually mostly on young people. And this is what we find here. We also wanted to explore the correlation with comorbidities, because as we all know, comorbidities may represent a poor outcome for people that are infected with SARS-CoV. And in this case, we found hypertension, diabetes, and obesity as the most common comorbidities in the group. And this is very important to consider both for the hospitals, but for the general population. And in closing, I wanted to mention that we must implement public measures. Since we are thinking of posing recommendations, we should think about how, what would be the best way to convince, to persuade the government to create a plan to stop community transmission and save lives. And for this, of course, what the Academy of Sciences has said, and also all the medical associations in Nicaragua, we are demanding to scale up the testing, the isolation, and the contact tracing, and a more exhaustive sampling, of course, but also decentralizing the testing. There's a need to consult and consider the opinion of the experts so that decisions are made based on knowledge. We have demanded that the WHO and PAHO provide a comprehensive audit. This is a very important, a comprehensive evaluation of health and social care system is now needed in preparation for the country for new waves of COVID-19 or for any future pandemics, of course. This is very important, and I think that Nicaragua, the people of Nicaragua should demand this comprehensive evaluation. And of course, since we are seeing all this data with health workers, I think it's important to provide for frequent screening at both at the public and at the private hospitals, and also provide the screening for other groups at risk. It is vital that government consider the respect for the health workforce, and they should not be considered not just as instrument of this regime to be used, to be exploited, but they should be considered as the human beings of great relevance in confronting COVID-19 as they are. And I wanted to express sincere thanks to everybody who participated in this study, some people in Nicaragua and some people abroad. Thank you very much.